Hey everyone, Dr. U here. Welcome to my channel where we explore all things about health and wellness. Today's topic is vitamin B12 deficiency. Most of us know we can get it from meat, fish, and dairy, but did you know there can be other reasons we might be missing out? We're going to explore 5 surprising causes of vitamin B12 deficiency that you might not have heard of before. If you're ready to take charge of your well-being, hit that like button and subscribe for more videos like this. Number 1. Pernicious anemia and autoimmune factors. Pernicious anemia is an autoimmune disorder where your immune system, in trying to protect you, ends up causing problems. It attacks the cells in your stomach that produce something called intrinsic factor. Think of intrinsic factor as a VIP pass for vitamin B12. Without it, your body cannot properly absorb B12 from the food you eat. So why is this important? Well, vitamin B12 is essential for your nerves to work properly and for making red blood cells. Without enough B12, things start to go haywire. You might feel exhausted all the time, more than just regular tiredness. We're talking about fatigue that lingers no matter how much you rest. Your mind might feel foggy, like your brain's on low battery. Some people even experience tingling or numbness in their hands and feet, which can be pretty scary. So the tricky part about pernicious anemia is that it creeps up slowly, especially in older adults. The symptoms can be vague and easy to mistake for something else, and it can go undiagnosed for years. So by the time it's caught, the deficiency can be severe, leading to more serious issues like nerve damage or heart problems. So what should you do if you think you might have pernicious anemia? Don't ignore persistent fatigue or strange tingling sensations. Talk to your healthcare provider. They can do a simple blood test to check your B12 levels. If pernicious anemia is suspected, they might also test for antibodies that indicate an autoimmune reaction against intrinsic factor. Number 2, gastric conditions and digestive issues. Your stomach isn't just a food processor. It's a complex system that helps absorb essential nutrients like vitamin B12. But conditions like gastritis can throw a wrench into this process. Gastritis, often caused by things like H. pylori infections or taking too many NSAIDs, those are the painkillers you pop for headaches. It can mess with your stomach lining. So this inflammation not only hurts, but it also reduces the acid your stomach needs to grab onto vitamin B12 from your food. Then there are surgeries that mess with the works, like gastric bypass or procedures that involve your ileum, which is part of your small intestine. These surgeries can literally cut off the path that B12 takes to get absorbed into your body. It's like rerouting traffic. It works, but you need to watch it closely to make sure everything's getting where it needs to go. Lifelong supplements or regular checkups become super important in these cases. And let's not forget about chronic digestive disorders like Crohn's disease or celiac disease. These conditions damage the delicate lining of your intestines, making it harder for your body to absorb all kinds of nutrients, including vitamin B12. Even if you're not feeling the classic signs of B12 deficiency like tingling fingers or overwhelming fatigue, it is crucial to keep tabs on your nutrient levels through regular screenings. Taking care of your gut isn't just about feeling good after meals. It's about making sure your body can absorb all the good stuff it needs to keep you running smoothly, vitamin B12 included. Number 3, medications and drug interactions. Ever wondered why some medications come with a side of vitamin B12 concerns? Well, it turns out several common drugs can mess with how your body absorbs or uses this essential nutrient. First up, there's metformin. This is the superstar for managing type 2 diabetes. While it's great at controlling blood sugar, it also has a knack for lowering vitamin B12 levels. How is that? Metformin interferes with calcium channels in your cells that vitamin B12 relies on to get into your bloodstream. Over time, this can lead to B12 deficiency, which might show up as fatigue or tingling in your hands and feet. Then there are proton pump inhibitors, also known as PPIs, those handy pills for acid reflux and heartburn. Well, they work wonders by dialing down stomach acid production, but here's the catch. Stomach acid helps release vitamin B12 from the food you eat. So less acid means less B12 absorption, potentially causing a deficiency over the long haul if you're not getting enough through your diet or supplements. Certain antibiotics like chloramphenicol and some anticonvulsants can also throw off your B12 game. They can interfere with how your body processes or absorbs B12, which is crucial for nerve function and making healthy red blood cells. If you're on any of these meds for the long term, or if you already have conditions that put you at risk for B12 deficiency, it's wise to keep tabs on your B12 levels. Your healthcare provider can monitor this with blood tests and may recommend dietary changes or supplements to keep your B12 in check. Number 4, dietary factors beyond veganism. When it comes to getting enough vitamin B12, it's not just about being vegan. While vegan diets get a lot of attention for their potential B12 pitfalls, other eating habits can also play a role in your B12 status. Take vegetarians, for example. They skip meat but may not always load up on dairy or eggs, which are rich sources of B12. If these foods aren't a big part of their diet, relying solely on fortified foods might not cut it. It's all about balance and making sure you're getting enough of this vital nutrient from various sources. Then there are cultural practices that can further complicate things. Some religious dietary guidelines exclude animal products altogether, which can pose a challenge for B12 intake. Imagine trying to navigate dietary restrictions while ensuring you're meeting your B12 needs. It's a balancing act that requires careful planning. And let's not forget about alcohol. Habitual drinking can mess with your body's ability to absorb and use B12, regardless of whether you eat meat or not. It's another factor to consider when thinking about your overall nutrient intake and health. Even how you cook your food matters. Overcooking or prolonged heat exposure can sap B12 content from foods that do contain it, reducing what your body can actually absorb. So even if you're eating foods known to have B12, the way you prepare them could impact how much your body can use. The key takeaway: whether you're vegan, vegetarian, or have specific dietary practices, paying attention to where your B12 comes from and how you prepare your meals can make a big difference in your overall health and well-being. Number 5, age-related changes and metabolic factors. Getting older has its perks: wisdom, experience, and hopefully more free time. But it also comes with a few health quirks, like changes in how our bodies handle vitamin B12. As we age, our bodies might not produce as much stomach acid or intrinsic factor, both of which are crucial for absorbing vitamin B12 from our food. Think of stomach acid as the key that unlocks B12 from your meals, and intrinsic factor as the helper that gets it into your bloodstream. Without enough of these, B12 absorption can take a hit. Metabolic conditions like diabetes and thyroid disorders, which are more common in older adults, can also mess with B12 metabolism. For instance, diabetes can lead to higher homocysteine levels and make it harder for your cells to take up B12, even if you're eating enough of it. It's a bit like having plenty of groceries, but not enough room in the fridge to store them. Changes in gastrointestinal motility, that's the way food moves through your digestive system, can also affect nutrient absorption. Slower or less efficient digestion can mean your body doesn't get as much B12 from what you eat. Given these challenges, it's a good idea for older adults to get regular screenings for B12 deficiency. This is especially important if you have health conditions or take medications that might impact B12 absorption, like metformin for diabetes or proton pump inhibitors for acid reflux. This might involve dietary adjustments, supplements, or simply being more vigilant about B12 levels. Hey, if you found this video helpful, smash that like button and subscribe for more informative health content.